Ladies and gentlemen, welcome back to my YouTube video channel. Today we will be continue a series of uh, continue education regarding to how to remove a tooth and replace on the same day visits. And I want to show you a specific case. So let me share the screen and so we can get started. Here is the uh, picture. Before we do anything, I want to ask you guys to subscribe to this channel so you can I can have a chance to upload video and we can you guys can have the latest update. So please click on the subscribe below, and then so that way you can continue watching this video. Here is the topic of the day. Topic of the day is how to manage or how to handle the single tooth extraction and implant placement on the same day, and how to preserve the tissue. The tissue here is including hard and soft tissue. So as you can see, this particular video, we put the we remove tube number 5, infected tube, place the implant and restore the implant and preserve volume of the bone and the gum. So we didn't change anything. Again, please subscribe to my YouTube video channel so I can continue this video. Here's we go. Let's get started with this video. So if you are a general dentist or you take out the tube right now. This is tube number 6 and this is number 5. You remove this tube and there's a big giant space there. How are you going to keep preserving the gum? If you don't keep preserving the gum and you wait for about 6 months later, this area here no longer become the actual natural tissue like this. Is everything going to shrinking? So you have to keep to preserve the volume of the space here, as well as preserving the interdental papilla. In order to do that, you have to have a strategy. We do not want to miss the chance to keep this interpapilla gum. If once you remove this one and you just let it go, everything here is going to be flat. You're not going to be able to restore the original gum later if you don't do something immediately right now. So imagine, ladies and gentlemen, a big socket right here, really big. What we're going to do. So this is the initial state. The patient came and he did have a root canal, a bit of crown, but the internal part of the root have the resorption externally, and the pocket right here is 7 or 8 or 10 millimeter. Been a while on the distal here, and he doesn't feel comfortable every time he drink cold water, hot water, very sensitive. It's not come in from the root canal part, but it's actually come from the detachment of the gum, and that it put the heat or cold transfer down to the root surface into the periodontium, where the patient have a lot of discomfort. So we have to remove the tube. So this is how it happened. We remove the tube. And so you can see that this is original condition of the gum. If the patient smile and you have this tooth removed, you didn't do anything besides giving the patient the stay place or giving the patient some bone graft and just walk away, this area we're not going to be able to preserve this interproximal dental papilla here. So you have to do something. So here's the picture of the tooth removed. As you can see right here, this is where the margin of the crown was so deep under the bone, and the furcation is so close here. So patient always constantly have pain and sensitivity to heat, cold, even though it's a root canal treated. So I mentioned to you, we remove the tube right here, and we need to preserve everything that we have here. So what we did end up doing, where we placed in immediate implant with bone graft, and also we had to preserve the soft tissue by putting the hyaline abutment here, as well as having the surrounding of the socket with the collagen membrane, and then we're going to lay on top with the temporary composite that build according to the interproximal papilla, dental papilla. We want to have a temporary that almost like a crown, but cover everything up like that. No occlusion contact, you guys, no occlusion contact. This is the picture before we started, okay? We want to keep at least somewhere like this or better. So that's what we did. We put implant bone graft, collagen membrane around, gave the patient a temporary crown. That's what we did. And no occlusion contact. Within a 2 weeks later, this is how the gum looked like. So in about a few weeks later or a few months later, the gum should heal nicely and grow on top here. We removed the temporary crown, allow the tooth to heal right now. So we were able to regrow, regenerate the gum that's supposed to be missing right here if you didn't do that. So because we have a long hyaline abutment, and we also have collagen membrane plus the temporary crown contain the bone material here. So the gum now is growing really well. So in about a month, you can see that how the actual thickness of the soft tissue being preserved and being regrow nicely. This is before, right immediately. This is 2 weeks, and this is like 2 weeks later. So that's about 5-6 weeks later. Nice healing. That's what you want to see. Anyway, we could take impression with a scan body, with a digital impression, and then we will give the patient a crown. And you can see the soft tissue on this model here. You can see how thick the soft tissue on the buccal, lingual, very thick, no defect left behind. Crown will place in right in the middle, the screw right in the middle of the tooth, a little bit of the distal, not a bad idea. So you can see right now it's healing well. Before we take this out for doing this impression, digital impression, tissue look thick, nice, and beautiful contour, preservation of the tissue. From here, you can see taking out a tooth, big giant tooth, but we're able to preserve and restore. This is before and this is after. This is right immediately after the crown delivery. Within about a month, a year later, you can see the interproximal tissue should cover everything. But you can look at this angle and you can appreciate that we're able to actually pull the gum down farther down than this one. This one look longer. This one look a lot more ideal. So anyway, gum being preserved, tissue look a lot more healthier than this chronic irritation right here. Patient was happy, and we were able to finish the job and preserve the soft tissue and hard tissue. I want to thank you, my patient, for allowing me to use this video, this picture photo to show you guys. Any question, feel free to ask me. And as always, I like to remind if you enjoy this video, feel free to make comment and share or subscribe to my channel so we can continue this presentation weekly, daily. Thank you for watching. Take care, you guys. See you next video.